The Asthma and Allergy Foundation of America is here to empower you with knowledge so you can talk with your healthcare team and advocate for your health. I'm really excited to be here today with Dr. Dave Stukas. He's a pediatric allergist and the social media editor and host of the podcast for the American Academy of Allergy, Asthma, and Immunology. Dr. Stukas, thanks so much for being here with us today.
It's my pleasure. Thank you.
Dr. Stukas, what can you share with us about what someone can do to make the most out of their appointment with an allergist? So how should they prepare? What should they bring? What conversations should they have? Any advice you can give there?
We're going to ask you a lot of questions. So hopefully, you can give us some very specific details in regards to the types of symptoms that you're having or your child's having, the timing of onset, the duration, what treatment you've tried before, what's worked, what hasn't worked, what makes them worse. Because every answer that you give us takes us down a different decision tree in regards to, is this due to allergy or not? I'm always fascinated because all of the symptoms that can occur due to allergies can occur for non-allergic reasons as well. So it's my job as an allergist and the urologist is to try to figure out, one, what's the actual diagnosis here? And the story that you give us with all those details really helps clarify, is this allergic or non-allergic? Because prognosis and treatment and everything changes dramatically based upon that. So bringing that, all the medications that you tried or past medications, if you've seen other specialists or had, diagnostic testing done before, having those results with you, especially if somebody else performed allergy testing, that would be extremely helpful as well. And if you had other tests, including like chest x-rays or lung function testing, bring all that with you as well so that your allergist can review it at that moment during that visit, or ideally ahead of time if you want to forward that to them. And then just prepare yourself for what could be, a visit that lasts 90 minutes to 2 hours, depending upon, what your concerns are and the differential diagnosis of your condition. There may be testing that occurs during that visit, such as allergy skin prick testing. They may have lung function testing that they do, and so on and so forth. So make sure that you have, had something to eat. Make sure that you're, well hydrated and ready to, be there for a little while. And then lastly, if you are concerned about allergies and want to have allergy skin testing done, there are some medications that interfere with that. So make sure that you review all the information your allergist office shares with you about what medications you may need to stop, oftentimes about 5 days ahead of time. So most of these are going to be things like oral antihistamines, such as cetirizine or loratadine or fexofenadine and things like that. So I think that should get you covered, and bring lots of questions as well. And my personal favorite, some of my colleagues may disagree, if you have questions, write them down. Because it's a long day and it's hard to remember everything that you've been thinking about over the last few weeks or months as you wait for your appointment. So write them down and bring them with you, and make sure that you have time to answer all those questions and get them addressed while you're there.
I think these are really important tips, especially like you said, asthma and allergies, the symptoms are so similar to a lot of other conditions, or they may be indicative of a lot of other conditions. So it really does help to get the right diagnosis.